What's up, y'all? Dr. Michael Lewis here, CEO of Willow Healing Center, board certified family practice, where I offer concierge medicine. I thought today I'd have a little fun and talk about some of the books that are in my office, and they're pretty cool. Let's check it out, huh? Well, these are what are behind my desk, and some go back to medical school, some are kind of new, some are old, but let's start out here. We'll go left to right. It's pretty cool. This is what some would call the Bible, Robin's Pathologic Basis of Disease. This is the pocket guide, because this big daddy right here is the full. This is what we used to take in our lab coats, but as you can see, it's been worked all through medical school. That's what you do. Oh, and it falls apart when you've used it too much, so that's cool. Fitzpatrick's Clinical Dermatology, very good book, nice pictures. This is the book for primary care procedures. This is Fenninger's Procedures for Primary Care, as you see. Very good, everything from how to place a stitch to how to put in a chest tube. Very cool. This is the anatomy book for all anatomy books. This is Netter, and he's a great artist. Very cool. This is what we use during our first year, and still as of last week. It's a great book. Color Atlas of Anatomy. This is actual dissections of people. Probably one of my favorite books right here. Biochemistry Lippincott's. This book almost looks like, probably looks a little bit worse than the Robin's Basis of Pathology. I think I got blood stains, weird pictures, and stuff that you could barely read. Coffee stains. I just loved this book. Look at this page. Who does that to who does that to their book? Holy cow! But this was the first year of medical school, and it was probably one of the most important classes that we had. Natural pharmacy, got a lot of different things in here, from migraines to menopause, tinnitus. Sometimes we want to use stuff other than medication, and this is a great book to do it. Clinically oriented anatomy, it's okay. Let's kind of flip through. Histology, the cells under the microscope, very cool. The Diagnostic Manual of Herpes Virus Infections. I don't know why or where I got this, but you know what? It's very cool. And did you know that chickenpox is a herpes virus, just like shingles, and just like herpes simplex 1 on the mouth and 2 on the genitals? Here's a good one. This is a no scalpel vasectomy. I used to do them, but I don't anymore. This is a pretty good book, Essentials of Medicine. Gray's Anatomy. No, it's not a yearbook of the TV show. This is this thing goes back, 100 years or so, and you can see beautiful drawings, and we'll leave that here. Nice discussions. What else here? OBGYN, Handbook of Concierge Medicine, because that's always important. Behavioral change. These are just some basics that I've had here for a long time. Joe's Medical Pharmacology. Now this is fun. This just goes back. This was written by our pharmacology professor back in medical school, and he made us buy his book. So, whatever. Harrison's Manual of Medicine. This is kind of like our pathologic basis of disease in a way. This is the Bible for medicine that you would take on the floor, about take with you, about how to deal with anything from tick-borne infections, Rocky Mountain spotted fever, to valvular heart disease, how to treat, what kind of medicine you would use. And this one, like we said, this one just tells you all about the disease. This is how you learn about the disease. This is how you teach or treat the disease. Geriatrics, quite important, you know, especially for a family practice doc. I'm in California, so hey, Spanish for the healthcare professionals, English, Spanish dictionaries and whatnot, which are, you know, don't use very much. Successful Guide to Aging, sweet. This was actually, instead of Harrison's Manual of Medicine, this is what I use, which is the Oxford Handbook of Clinical Medicine. And you can see this one had quite a bit of stuff writing too. This is what I carried in my pocket on the boards, on the floors, because I did my 3rd year of medical school in London. And this is mostly what the US students had. This is what we had, and brilliant book, by the way. It's organized very well. So that's definitely a great one if anyone happens to be looking for a good book. Family Practice Handbook, sort of similar to Harrison's, but this is more focused on family practice. You know, family practice, we do women's health, pediatrics, OBGYN. So this has a little bit more, and it's a little bit different, but where medicine, you do a lot of in-hospital work. So more geriatrics, some basic, this was also in my pocket, you know, base guide to physical exam. Pretty cool stuff too.